It's no secret the Omicron variant is the strain of COVID-19 causing this current surge in new cases and hospitalizations in Utah.
But a subvariant of Omicron, the so-called stealth variant, is also starting to spread here. As news specialist Jed Bull shows us, the new data suggests it is 1/3 more transmissible than Omicron.
BA.2, also known as the stealth variant, was first identified in Utah January 12th. That's according to the Utah Department of Health. Evidence out of Europe suggests it is not more severe than Omicron, but it's likely more transmissible.
That doesn't look any more severe.
Dr. Todd Vento with Intermountain Healthcare is still learning about BA.2, a subvariant of the Omicron variant, which is BA.1. The infectious diseases physician says Denmark now estimates more than 80% of its cases are BA.2, not impacting one age group more than another.
And they don't see higher numbers of hospitalizations compared to what they had with Omicron or the BA.1. In fact, their number of cases have gone up, but their number of ICU hospitalizations have been going down.
Early data from Denmark indicating BA.2, the stealth variant, spreads 33% faster than BA.1.
We don't know if BA.2 is less severe than BA.1. We don't see it being either right now. It looks very similar, but it's too early to make a final judgment on that.
5 cases of BA.2 have been sequenced in Utah. Dr. Kelly Okeson is the chief scientist for next generation sequencing at the Utah Department of Health.
I don't think you're going to see that huge increase in spike in cases that we saw with BA.1, the original Omicron variant. But you might see us kind of have this prolonged tail as we come down off of the peak, if you will, of our cases.
Okeson tells me our COVID-19 tests will detect the stealth variant, and the vaccines should provide protection against severe illness. He recommends getting boosted and masking up in public for the best personal protection and for the good of the community.
If we stop the spread, we stop variants, we stop spikes in cases, we stop those spikes in hospitalizations and deaths, and hopefully bring this thing down to a non-pandemic, right? Bring this down to something that's more manageable.
Both experts suggest that our community needs to better protect itself against COVID-19, or these dangerous variants will continue to emerge. For KSL 5 News, I'm Jed Bull.